Okay, welcome back. In this video, we'll go over Chapter 2 in our anatomy course, the human body, reading the map. Alright, this chapter will provide you with the major external map of the human body. And as we get further along into this course and into future videos, we'll get into more interior regions of the body. Medical directional terms, lateral, medial, superior, inferior, and body locations will serve as our foundation for our journey as we get through the human organism. By the time we get through this journey, by the time we get through this lecture series, you'll know your own body like, quote, the back of your hand. Alright, learning objectives for chapter number 2. List and describe the various body positions. Define the body planes and associated directional terms. Locate and describe the body cavities and their respective organs. List and describe the anatomical divisions of the abdominal region. Be able to identify and locate the various body regions. Explain the various imaging techniques used that are used to view the body. And lastly, to describe situations in which body position can help or hinder the disease process. Alright, we'll start with the map of the human body. Directional terms like east-west, north-south are needed when you're trying to read a map. Alright, maps representing a specific region often have more detail, making it easier to explore. So the same thing goes with the human body. We have our own directional terms used when it comes to anatomy and physiology. Now, scientists have created a very standardized, very accepted list of body directional terms, splitting the body into distinct regions and sections and cavities and planes and so on. They're used to clearly and rapidly locate various anatomical features. And often anatomical landmarks will serve as a point of reference. Why is all this important? Well, the reason why this is important is to pinpoint with at least some accuracy injury, for example. Does the statement, "I have pain in my stomach," will tell you anything? Well, no, it could be any number of things. It could be an intestinal issue, it could be a gallbladder issue, it could be an ovarian cyst if you're female, it could be any number of things. You can't just say, "Well, my belly hurts." Well, where? What part of your belly? What part of that area are you talking about? Knowing where to focus on will help increase the speed at which you can treat that injury or disease and be able to fix it faster. So questions about what type of pain, the exact location, and intensity are also good ways to determine the cause of that pain. Alright, next we'll talk about various body positions. Now, the body can assume many positions and therefore can have different orientations, and different positions are used depending on what you are trying to treat or what you're trying to evaluate. Because some things just won't work for others. Some things will help, some things will not help. To standardize orientation for the study of anatomy, there is a very accepted starting point that all scientists use. So directional terms can all mean the same thing. You think of all the scientists all over the world who speak any number of languages. You want the term like, say, superior to mean the same thing in English like it would in French or German or Russian or any other language. So the very starting point for all those directional terms is what's called anatomical position. Alright, in this position, the person will be standing straight up, facing forward, their feet parallel, about shoulder width apart. Arms are hanging at their side, and the palms are facing forward. And this is how that would look. That is the standard anatomical position from which all directional terms are based off of. Medial, lateral, inferior, superior, proximal, distal, and so on are all based on this starting position. Alright, there's some other important body positions. Supine and prone, for example. If you are in a supine position, you'll be laying facing upward on your back. If you're in a prone position, you're laying downward, facing down, so laying on your stomach. Another important position, when it's commonly used when a patient goes to any kind of doctor's office or especially an emergency room, it's called Fowler's position. This is sitting in the bed with the head of the bed elevated between 45 to 60 degrees, basically sitting up in bed. Now, this will help to facilitate breathing for patients and also be a lot more comfortable whenever you have to eat or drink something, or also to talk to a medical professional. It's really, really difficult to talk when you're laying flat on your back comfortably, or eat when you're laying flat on your back comfortably. Well, here are some images of some other common positions that a patient could be in. On this one, the person is laying flat on their stomach, laying face down, so that's prone. laying flat on their back, facing upward, would be supine. Fowler's position here, in bed, sitting up about 45 to 60 degrees. That's very standard. And the one up here, Trendelenburg, the feet are elevated and the head is not. We'll talk about this in a second. So based on what you are trying to evaluate in the patient, what you're trying to test for, various positions could either help you or hurt you. Say a good example of that would be patients with secretions at the base of the lungs. If you're trying to evaluate this or treat this, you would much prefer to have your patient in the Trendelenburg position. Having the feet elevated and the chest not is to help drain those secretions out of the base of the lungs. If they were in, say, this position here, in Fowler's, all those secretions would remain at the base of the lungs. They wouldn't go anywhere. But if you were in the Trendelenburg position, all secretions would head upward toward the mouth. All right, patients that are who have cerebral injury or cerebral bleeding should avoid that position, Trendelenburg, because it will just increase blood flow to the brain, which would increase the intracranial pressure, which is something that you obviously would not want. So different injuries, different conditions will warrant different body positions for the patient. Patients that are placed in the Trendelenburg position are more prone to aspiring or choking on their own vomit into their lungs. So they should not eat between 3 to 4 hours before being put in this position. Patients with orthopnea have difficult time breathing when they lie flat. So propping them up with pillows will assist the diaphragm in working against gravity. So all this goes back to what's going on with your particular patient, what you are trying to evaluate, what you're trying to treat. So depending on what is going on with your patient will help you to determine what kind of position they should be lying in. If a patient has engorged or swollen neck veins, such as the jugular venous extension, while in the upright sitting position, this indicates usually a severe heart failure because the pressure of the blood being backed up into the venous system is greater because of the effect of gravity. So just by sitting up in the typical Fowler's position, being able to notice things like this can give you some key indicators on what could be going on with your patient. All right, dizziness from when a patient changes from a seated position to a standing position can usually indicate orthostatic hypotension. This develops because the heart can't compensate for the extra work that the patient goes through against gravity from sitting down to standing up very quickly. So the result of that inability to compensate for that results in a lesser amount of blood going to the brain, and that's why they become dizzy. All right, now we'll talk about body planes in directional terms. Sometimes it is necessary to divide the body or even organ or tissue samples with imaginary planes or imaginary lines, and this is used to help divide something into more specific regions or areas. So you can talk about them with more detail. The first one, the transverse or horizontal plane. This will divide the body into a superior and inferior sections, also referred to as cross-sectioning of the body. You think of this as the line where your belt would be. So from belt part up, from abdomen up to your head, that's the superior part, and from where your belt would be, and then down to your feet, that would be the inferior part. So that's cutting you in half, basically, the transverse or the horizontal plane. Some directional terms that go along with the transverse plane. Superior always means toward the head or the upper body, and the opposite of that would be inferior, which would mean going below or below a body part. Terms you can also use cranial or cephalic. Those also mean toward the head. Inferior, also you can use the term caudal, means away from the head or toward the lower part of the body. And these are directional terms. These are points of reference. So you can be both inferior and superior at the same time. For example, your knee is superior to your ankle. It is above your ankle, but your knee is inferior to your thigh. So it depends on what you are comparing it to. And there's an image on how the horizontal plane would look. If we were to cut this patient in half here at the belt line, from this part up would be the superior part, and here down would be the inferior part, or caudal part. Alright, the next plane, the median, or also called the Midsagittal plane. This will divide the body into right and left halves. And the term medial is a reference to the middle of the body, or toward the midline of the body. So medial, M for medial, M for middle is a good way to keep this straight. And the term lateral means going away from the midline or going to the side. For those of you who are fans of American football. A lateral is pitching the ball to the side, not forward, not back, but directly to the side. Here's how that would look. The median plane going right through the middle of the body, where you have an equal right and left half of the body. Going toward that midline would be medial, and going away from the midline would be lateral. Our next plane, the frontal, also called the coronal plane. This will divide the body into a front and back sections. The anterior, or also referenced as ventral, refers to the forward or toward the front of the body. And posterior, or also known as dorsal, references the back of the body. Again, we have this image here, this plane, the frontal or coronal plane. This body part, or this section of the body would fall forward. That'd be the anterior section. And this part behind her would fall backwards. That'd be the posterior part, or dorsal part. All right, now we'll get into some other directional terms. The first group, proximal and distal. Proximal refers to body parts that are in close point of reference to the origin of the body, or really to the trunk of the body, to the chest. And distal refers to them being further away. So think of proximal as in being proximity, as being closer toward the trunk. And distal as being further distance away, being further away. So using, say, your shoulder as a reference point, your elbow would be proximal to that, and your fingers would be distal. So comparing your fingers and your elbow, your fingers are further away from your shoulder than your elbow is. So if you're using your shoulder as a starting point, because the elbow is closer, it's in a closer proximity. That'd be proximal. Fingers are further away or further in distance away. That'd be distal. All right, here's a generic image referencing many directional terms. The anterior, or the front part of the person. Again, we're all starting in anatomical position. I see the midline would be right down here through the middle. So going toward that would be medial, going away from it, lateral. Superior going up toward the head. And the inferior going away from the head. The proximal getting closer to the trunk, and distal going further away from the trunk. Alright, the next pair, internal and external, are basically what the names imply, being inside or being outside. External means toward the outside, such as your skin is external to most of your other body organs. It's also the largest organ that we have. The internal means toward the inside. So most of your organs will be internal. Some other directional terms, superficial means toward the surface of the body. And the opposite of that would be deep, which means away from the surface. A gentle or a light scratch on your hand would be a superficial scratch because it's toward the very surface. A very deep wound is usually going to be more serious because you're involving more tissues and deeper vessels and so on. Central will refer to the center of the body, and peripheral would refer to the extremities, going to the periphery or to the outside or the side. All right, here's some common ones, common directional terms. These are the ones that we've covered: proximal, distal, external, internal, superficial and deep, central, peripheral, and medial, lateral, and it has their meanings here, how they're correctly used in the sentence. It's a very, very beginning list of directional terms. Here's an example. Both of these figures have a type of cyanosis or a bluish tint to the skin. One on top here, central cyanosis. Central because it's toward the center of the body. As you can see, in the face and neck, the chest, the abdomen. And the one on the bottom, peripheral cyanosis, toward the extremities, toward the side of the body. So in the fingers and in the toes. So both forms of cyanosis, but being able to determine or being able to distinguish what central means and peripheral means can give you a big clue on what could be going on. So there's a very big difference between what's going on with this person and what's going on with this person, even though they're both forms of cyanosis. All right, now we'll move on to the various body cavities. The body has two large spaces or cavities, and these spaces are used to house and to protect various organs. And the two cavities are either going to be toward the front or anterior or toward the back, which are called dorsal. Okay? The dorsal cavities are what would house the brain and the spinal cord. They're toward the back. The larger cavity, the anterior cavity, is located in the front, because remember the term anterior means toward the front, and that is subdivided into two main cavities. Sometimes it's divided into three. If you want to be more technically correct, divide it into three. You have the thoracic cavity, which houses the heart and lungs, and then the abdominopelvic has everything below the abdomen. So basically the abdominal cavity plus the pelvic cavity. So it is okay to group those together, abdominopelvic cavity, but technically they are two separate cavities because they house two different types of organs. So it's not wrong to group them together, but it's more specific to separate them into the abdominal cavity and the pelvic cavity independently. Like we talked about a second ago, the thoracic cavity has the heart and lungs and the major blood vessels, such as the aorta, for example. The abdominopelvic cavity, this will have all the digestive organs in the upper abdomen. This is where you'll have most of your internal organs in the abdominal part of the abdominopelvic cavity. The stomach, the intestines, the gallbladder, liver, pancreas, spleen, and so on. Then the pelvic cavity is the lower portion, more inferior of the abdominopelvic cavity. The internal reproductive organs, the very last part of the large intestine, and also the urinary organ. So the dorsal cavity. Dorsal means toward the back, so this will include the brain and spinal cord. The brain is housed by itself in the cranial cavity. Then the spinal cord is found within the spinal cavity, or the vertebral cavity. Alright, so for this image, the ones that are in brownish reddish color would be the dorsal cavities. So you have the brain and the cranial cavity, and the spinal cord and the vertebral cavity. The ones that are in this purple color are the anterior cavities, the larger cavities. Here you have the diaphragm separating the thoracic from the abdominal. So the first one, the most superior, would be thoracic, the heart, lungs, some of the larger blood vessels. The abdominal cavity, basically everything that's in your belly and your abdomen would be found here. And the most inferior and the smaller one, the pelvic cavity, the last part of the large intestine, and the reproductive organs and the urinary organ. There are some other smaller cavities found throughout the body. See the nasal cavity, just behind the nose. The oral cavity or the buccal cavity, just the space within the mouth. And then the orbital cavity, which will house the eyes. Alright, now we'll talk about the various abdominal regions. Because when you're talking about, say, belly pain or abdominal pain, you can't just say, well, my belly hurts. Well, because that could mean any number of things, many number of organs, any countless numbers of conditions. So being able to divide just the abdomen into subregions helps to pinpoint what could be wrong and how to treat it more efficiently. So think of the abdomen as being divided into a tic-tac-toe pattern, a 3x3 pattern where you have 9 boxes. And the name tells you where these are located. And we're only talking about the abdomen here. We're not talking about the thoracic, I'm talking about the pelvic or anywhere else, just the abdomen, because it is so large of a cavity, there's so many organs found within the cavity, it has to be subdivided into further regions. And the first one, the epigastric. Epi always means above, gastric always means stomach. So this is just above the umbilical region, found just between the right and left hypochondriac regions on either side. So we're thinking of a tic-tac-toe pattern. This would be the upper middle square. And then to the left of that would be the left hypochondriac, and to the right of that, the right hypochondriac regions. And also important to keep in mind, when we say terms like left and right, it is not how you see it as the observer, it's about the patient's right and left. For those of you who have been on stage as a performer, it's the same principle as being stage left and stage right. As you're watching it in the audience, when an actor goes stage left, they're going to the audience right. So it's the opposite of how you would think about it. It's about the patient, not about you, the observer. All right, the umbilical region is located right in the center of that tic-tac-toe pattern, right where your belly button is. And to the right and left of that would be the right and left lumbar regions. Remember, lumbar references the lower back. And then the hypogastric, remember hypo means below, gastric means stomach. So this would be just inferior to that umbilical region. We're going back to the tic-tac-toe pattern. This would be on the bottom row in the middle. And to the right and left of that region would be the right and left iliac. So we get into our tic-tac-toe pattern. Belly button right in the middle, umbilical. Just above that, epigastric. Right hypochondriac, left hypochondriac. On either side of the umbilical, right lumbar, left lumbar. Hypogastric, lower middle square, and right iliac, left iliac. And again, all of these on this side are right, all of these on this side are left. Even though as you're looking at this image, this is the right hand side of the image, it's not about you, the observer, it's about this person. This is their left hand side. This is their right-hand side. So it's important not to get those backward. Something that's a little bit easier to follow would be the abdominal quadrants. This is a much more practical way to break up the abdomen into 4 general areas as opposed to the 9 very particular regions of the abdomen. Again, these quadrants are only referencing the abdomen. And this is usually very helpful in describing or localizing abdominal pain. Because they are quadrants, there are only 4. You have the right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. Again, all this is on the right-hand side, all this is on the left-hand side. This is more superior, so that would be upper, these would be lower. A quick list on what could be found in each of these quadrants. For the right upper quadrant, the liver, the right kidney, the pancreas, the gallbladder, some parts of the colon. For the left upper, parts of the liver, spleen, left kidney, stomach, other parts of the colon, the pancreas. Parts in the right lower, the colon, small intestine, the major arteries and veins going to the right leg, and the ureter and the appendix. And the left lower quadrant, parts of the colon, small intestine, the major arteries and veins going to the left leg, and also the ureter. And the areas toward the middle line, where these quadrants intersect, aorta, pancreas, small intestine, bladder, and of course spine. So if a patient comes in and tells you, well, I have pain down in here, right lower quadrant, we know it's not going to be the stomach. You know it's not going to be the liver. Being able to get a general area of where in the abdomen the pain is coming from will give you a good clue on how to treat it. Again, both the 9 regions we talked about and these 4 quadrants are only in reference to the abdomen. Alright, there are some shorthand ways to write down these quadrants, so you don't have to write down right upper quadrant all the time or right lower quadrant every single time. You can just use the acronyms that go along with them. The right lower quadrant, RLQ, and the right upper quadrant, RUQ. Pain that comes from the right lower quadrant could easily mean a appendicitis. Pain in the right upper quadrant could mean a gallbladder issue or some liver issues. And the same pattern goes true for the left lower quadrant and the left upper. Left lower would be LLQ and left lower LUQ. Same basic process for all 4 of these. Alright, on this image we have 2 separate views of the spinal cord or the spinal column, and the various colors represent the various types of vertebrae. So cervical will be the first 7 vertebrae at the top of the neck. Cervical is always a reference to neck. The next set of vertebrae, the next 12, are thoracic, because they go along with the thoracic cavity. Lumbar, the ones in this purple color. The next 5 are the lumbar vertebrae. These are the lower back vertebrae. And then the ones that are all fused together here, the sacrum, the very tail end here, the tailbone, the coccyx. So again, these names, such like directional terms, tell you where this is being reference. So an injury such as on the 5th cervical vertebrae, or C5, would be way up here, not down here. So cervical, thoracic, lumbar, then sacral, and then coccyx. And next we'll go over some other body regions to help you locate various structures and identifying pain in the patient. Axillary, brachial, femoral, patellar, pubic. And all these names have very particular meanings. The axillary would be the armpit, brachial, the arm, femoral, the inner thigh, the leg, patellar, the knee, and then pubic in the groin. And here are some very common anterior and posterior body regions. Pedal for the foot, patellar, the front of the knee, the pubic, the groin, umbilical, where the umbilical cord used to be, right here at the belly button, carpal in the wrist, brachial upper arm, antebrachial forearm, and there are countless more body regions and body terms, but there are many that are going to be much more common than others. And here's a very brief list of some common body regions. Now here are a few more and their locations and a common medical example. Antebrachial, the forearm, between the wrist and the elbow. Brachial will be the upper arm, a common place to take blood pressure, with the blood pressure cuff. The femoral, the inner upper thigh, where you would commonly check the femoral pulse to check blood flow to the legs. Oral in the mouth, orbital in the eyes. Plantar, the sole of the foot. Plantar warts are warts that are found on the bottom surface of the foot. Gluteal in the buttocks, a common site for injection of medication. thoracic and the chest, and so on. Again, a very short list of very common body regions and examples of their locations. Next, we'll get into various methods that are used to image the body. The first one, X-rays. These are forms of high energy radiation that will penetrate the body and give a two-dimensional view of bones and air and tissues in the body. A standard X-ray can be computer enhanced to give a little bit more detail and contrasting to allow for some realistic 3D effects. So this is your standard X-ray that almost everyone has received at some point in their life. Another form, a CT, commonly called a CAT scan, computed tomography scanning. This uses a very narrowly focused X-ray beam that will circle rapidly around the body. Something that's a little bit more detailed, the MRI, magnetic resonance imager or imaging. And even though this offers the greatest amount of detail of these imaging types, not everyone can receive an MRI. We'll talk about why that is here in a few minutes. Alright, going back to X-rays. These are produced by a passing X-ray beams through a very particular part of the body, and then exposing that on a photographic film. And that standard black and white image that we've all seen to indicate what could be wrong in that particular area. The dark regions on that film are called radiolucent, and the light regions are called radio-opaque. Now you're able to tell some things such as general density just by looking at an X-ray. Air, as you can imagine, will be the least dense, and this will show up as black on a standard X-ray. Tissues and fat, of course this would depend on the thickness of that tissue that you're X-raying. The thicker the layer, the lighter the appearance on the X-ray. Water, such as edema of swelling in tissue that's swollen and in blood, will be a mid-range density. Will be denser than air, but not as dense as bone. The type of the most density, or the highest density, will be bone or metal. The film image will appear very white or very light in color compared to the others. And when it says metal, we're talking about, say, a hip replacement or a medical implant, such as a defibrillator or a pacemaker, for example. Those show up very bright because they are metal. Some standard X-ray positions. The first one, PA, posterior-anterior. This is where the X-ray will pass from the patient's back to the front, then onto the film. This is where you go and basically hug the column where you're getting X-rayed. The X-ray is going from your back toward the front. So going from the posterior part of you to the anterior part of you. That's why it's called PA. As the standard position that's used where you're standing upright and basically putting your chest on that cold film or cold metal sheet. You're hugging the column behind it. Opposite of that would be the AP position, antero-posterior. You're putting your back against the film or against the column and getting the front of your chest X-rayed. The X-rays are going from the front of you, the anterior portion, through you to back behind you to the posterior section. So it's going from into your chest and then out of your back. That's why it's antero-posterior. And this is the position often used for a portable chest X-ray. If a patient is in a bed and can't be moved safely or efficiently down to radiology to get X-rayed, they'll bring the X-ray machine to them. Well, if they're in a seated position, in that seated Fowler's position, well, they're automatically going to be in the AP position. The X-ray will go into their chest and out of their back. That's AP. Another position, lateral, is where the X-ray beam will pass from one side of the film to the other, going from your side through the other side of you. And this is often used to complement the other angles, the other views, to get a 3D perspective. So it's very common to get a lateral X-ray to complement one of the other two positions. So you get a more encompassing perspective of what's going on internally, as opposed to just front to back or back to front. You're able to get a clearer image of what's going on because you are looking at the body from different angles. The CAT scan or CT scan. This will produce very high resolution series of what are called slices of the body. This will create a three-dimensional view of the structures as well as tissue structures and solid organs. Now this is a really good detail in this type of imaging, but also it will expose the body to much higher levels of radiation. The ones with the most detail, the MRI, magnetic resonance imaging, will use magnetic energy to image the body. This will produce a cross-sectional image of the body, much better clarity than CT, but as we mentioned before, not everyone can get an MRI. And the biggest reason is for people who have prosthetic heart valves or metal implants like a defibrillator or like a pacemaker. Now think of what they're being placed into. It's a really big magnet. You don't want someone who has anything metal inside them to be put inside a big magnet. It would basically rip it out of them. So it's not really worth that risk to even attempt to do something like this with MRI. So people who have those kind of implants, who have prosthetic valves, can't even be exposed to MRI. Also, people who may not have any of those issues, but may be claustrophobic. You're basically lying in a very small tube, a very small tunnel, while this circles all around you. If people get claustrophobic, they're going to have an anxiety attack, and they're going to panic, and that would negate any data retrieved from this type of imaging. So again, not everyone can have an MRI, even though it offers the best and the clearest detail of any of the imaging. Here are some contrasts of an X-ray and a CT and an MRI. In this image we have an MRI of a head showing a very large hemorrhagic lesion right here. This is a 3D scan of a face with multiple facial fractures. As you can see a little bit more detail here. As a standard X-ray of a knee joint with osteoarthritis. See the difference in lightness and darkness, the bones here, and the very bright density here and here. And here's an ultrasound of the left kidney and spleen. Not as much detail, obviously, as the others. And the ultrasound, or sonography, will use sound waves to image the body. And this will allow body cavities to be imaged in real time. So a good example of this is during prenatal care, when a woman is pregnant, to being able to observe fetal development and movement, and observing locations of or actions of heart valves in an echocardiogram, for example. Alright, and that brings us to the end of Chapter 2, learning the map of the human body, and we will continue this course with our next video in Chapter 3.